Good afternoon. My name is Dr. Leonie Herx. I'm a palliative medicine specialist, associate professor, and head of palliative care at Queen's University. I'm the immediate past president of the Canadian Society of Palliative Care Physicians, and have been on their board of directors for the past 8 years. I'm also an advisor to the Vulnerable Persons Standard, an internationally recognized evidence-based framework that outlines the safeguards necessary in a system for medically administered death to protect vulnerable persons who may be subject to coercion and abuse. I come before you today to share concerns that are not mine alone, but are shared by many physicians across Canada, evidenced by the 959 and counting physicians from all medical specialties who have signed our Made to Mad petition that was submitted to this committee. In the Carter versus Canada ruling, the Supreme Court stated that a carefully designed and monitored system of safeguards would limit risk to vulnerable persons. In our recent publication in the World Medical Journal in April 2020, my palliative medicine colleagues and I documented concerns and reviewed evidence of errors and harm occurring under the current C14 MAID regime. A copy of our paper has been submitted to you as well. C7 proposes to further reduce these safeguards and put more Canadians at risk of wrongful death. Year after year, there have been documented cases of non-compliance and misapplication of the law and policy with respect to MAID in Canada. The Chief Coroner of Ontario, the End of Life Care Commission in Quebec, and very recently, the Correctional Investigator of Canada have all reported on these issues. We also see instances of vulnerable patients being told by the healthcare team that they should consider a medically administered death because the cost of their care is too great. Roger Foley from London, Ontario, required 24-hour care that was not able to be provided in his home. While living at the hospital, an administrator suggested that he get MAID not out of compassion for his circumstances, but out of concern for the cost of his care on the system. This conversation was recorded and, of course, has been widely shared. MAID has also been suggested when the healthcare team perceives an individual as not having value. Candice Lewis, the 25-year-old woman with a developmental disability and chronic medical problems, while receiving emergency treatment in hospital, when a doctor approached her mother, suggested that she consider MAID for her daughter. Her mother said they were not interested in MAID, and the doctor told her she was being selfish. The doctor then tried to convince Candice herself that she should get MAID, and because Candice felt scared, she asked to go home. The family complied and took her home, also feeling that it was unsafe to stay in the hospital. The UN Special Rapporteur on the Rights of Persons with Disabilities issued concern after a recent trip to Canada in 2019, stating that she was extremely concerned about the implementation of the legislation on medical assistance in dying from a disability perspective, and that there was a lack of protocol to demonstrate that persons with disabilities had been provided with viable alternatives when eligible for assisted dying. We have seen countless patients whose hope and resilience were restored when they had their basic care needs met. We know that many people requested medically administered death out of fear of being a burden to others. This sense of being a burden and demoralization is amplified when real options to support living do not exist. If we are trying to make a medically administered death regime safer for Canadians, then we should look to the Victoria, Australia legislation, which employs stringent safeguards to address important issues such as the risks of coercion. I've included sections of the legislation in my written brief for your reference. In the Victoria legislation, doctors must not bring up assisted death to a patient unless they ask about it. This is especially important for persons who already feel a burden and less valued in society due to systemic discrimination. Bill C7 is written in such a way that a patient could choose to die before they have actually received therapies that we know in medicine have a high likelihood for recovery or relief of suffering. In other countries where MAID is legalized, it is most often only available for those who are dying. Regardless, all other jurisdictions require that physicians determine that there are no other options of care left to pursue as a last resort only. Physicians who know that there are reasonable treatment options for their patients have a professional duty to instill hope and support resilience and not to stimulate a desire to die. My professional integrity as a physician compels me to offer recommendations to promote the health and well-being of my patients. If I am required to present death as an option alongside evidence-based standards of medical care, this compromises my ability to provide good care to my patients. Doctors need to be able to work with integrity and have our conscience rights respected. For the sake of vulnerable Canadians and the practice of medicine, I urge this committee to make significant amendments to this proposed legislation. Thank you.